Thank you so much. I do appreciate the limitation of 7 minutes, and I'll try to cover up a few interesting slides in these 7 minutes. Reform, transform, and perform have been very aptly defined, but I'll take a little detour and also redefine them. When we come to the theme of the nation at this moment, this is the basis of whatever we do in terms of national policy. And that is healthy people make a healthy nation. And therefore, health of the population must form an integral part of public policy for socio-economic development of the society. And access to healthcare is also an integral part of a socio and economic policy of the country. So when we talk of reforms, we reform in health sector entails public policy initiatives to foster public-private partnerships and incentivize investment in healthcare for the development and strengthening of healthcare infrastructure in the country to achieve universal and equitable access to healthcare. That is the mandate, that's the political mandate, that's the social agenda of our country. And when we talk of transform, we are talking of transformation of healthcare. It implies adoption of efficient design forms, state-of-the-art medical technology, and current knowledge and human skills in medicine and allied sciences to create an ambience for the practice of contemporary medicine with compassion and care within a safe and secure environment conducive to the recovery of the sick. But when we come to perform, we are again faced with a situation that performance signifies adoption of contemporary clinical protocols and implementation of policies, procedures, and guidelines in the management and operation of healthcare facilities with utmost efficiency, clinical effectiveness, and the quality in the delivery of care. If there's a consensus of these definitions, then charting a blueprint to transform has many challenges. With challenges of achieving universal and equitable access to continuum of care, I've already said so. With challenges of financing, provision, and regulation of healthcare, with challenges of building capacity for formal and continuing education in medical and allied disciplines, with challenges of attaining national standards of quality, with challenges of medical ethics and credence, with challenges of clinical governance and audit trail, with the challenges of management and operation of business functions and utmost efficiency and economy, with the challenge of seamless integration between management and clinical functions. So roadmap to reform in health sector has many challenges and include adoption of information and communication technology in the clinical practice to facilitate availability of clinical information at the point of care. Now, since clinical adoption of information technology is a prerequisite to clinical governance, the challenges before the IT industry engaged in healthcare are loud and clear. Now, if we go to challenges before the industry, can we give us a full function clinical desktop which the provider of care are able and willing to access and adopt in their clinical practice? We had some of the speakers this morning challenging this. Do we have a solution that is hands-free or operates with a stylus or a mouse with minimal use of keyboard? Can you give us a rules-driven user interface which blends into clinical workflow and gives the providers of care timely alerts and disease management? Can you empower the provider of care with a knowledge base and protocol-driven decision support system to address patient-facing clinical needs? Can you give us an appointments and rounds list on a handheld and give us the option to set our walk paths? Most significantly, can you give us a virtual and secure access to clinical information at the point of care? Now, further, can you create a national IT backbone that provides high-speed internet connectivity with multiple points of presence? IT backbone that offers security-enabled cohesive web framework with authentication, data confidentiality, and integrity? IT backbone that supports connected healthcare records using regional health information exchanges and central data repositories for secure access to clinical information? This is a challenge before the industry, that can we create an internet cloud environment where vendors, partners can join hands, where trading partners can also be integrated, where participating organizations like hospitals, practices, and clinics can join. So health information exchange with a central data repository, with portal, provider and portal, patients for patients are the challenges for tomorrow. And if I want to try and see that if we create a community level health information exchange with a clinical central data repository where trading partners, vendors, care providers, consumers, payers, and employers come together, then access through patient and provider portals with care management portals, and then within that multiply them into multi-org interoperable environment, and then take it to multi-tenant national IT backbone healthcare. These are the challenges that are faced by the IT CT industry, and what some of the speakers this morning had raised issues that can we transform from paper to paperless. Unless we face these challenges, it will be absolutely impossible. With these words, it's been my endeavor to describe the unique character of health industry and the impending challenges before the ICT industry to provide solutions that are robust, performing, scalable, and most significantly, adoptable by the care providers to enhance technical efficiency, patient safety, and quality in the delivery care, to facilitate practice of contemporary medicine effectively and most significantly, ethically. The question is, are we prepared? Thank you very much.